Medication that will prevent receptor activation. What term would best describe this medication? Antagonist. Which effect are you, the nurse, going to observe in the patient receiving this medication? For nanotrope, dobutamine, agonist of norepinephrine receptors to increase norepinephrine receptors. Increased heart rate. Concept of half-life. The amount of time it takes for the drug in the body to be decreased by half. Which of the following best describes why clients that receive the same medication receive different effects of medicine? The differences in clients' metabolism. Which term describes the process where one medication affects the way one drug affects the other? Drug-to-drug interaction. You're going to give a medication with narrow therapeutic effect. What will be true? Dose must be monitored closely to prevent toxicity. Client with decreased cardiac output that will most likely impair WOF, pharmacokinetic process, impairment and distribution. You have a patient who recently started on lithium. You're training a new nurse. What comment by the new nurse indicates that more teaching will be needed? Lithium is contraindicated with antidepressants. How many bipolar conditions do we treat? 2, type 1 and type 2. A female patient diagnosed with Parkinson's disease. Which drug will the healthcare provider administer to improve muscular coordination? Levodopa, carbidopa. Skeletal muscle relaxant is a drug of choice for treating malignant hypothermia. Baclofen. Muscle relaxant used immediately in emergent situation when you have a patient who needs treatment for malignant hypothermia. Dantrolene. You're working in a clinic reviewing client labs. You notice a client's phenytoin, so you monitor lab value for therapeutic range. You recognize something abnormal. The level is 26 micrograms per liter. You are caring for a patient taking lithium with BPD. Which value is most essential for the nurse to communicate to the healthcare provider while the client is taking this medicine? The sodium level of 126. You're taking care of a client with a seizure disorder, taking valproate. What are we most concerned about in lab values? Liver enzymes. You have a client with generalized anxiety disorder. Which stabilization will be most effective? Alprazolam. This is a benzodiazepine. We have a patient with epilepsy going home with a benzo. Which discharge teaching do you need to provide? Sudden withdrawal from benzos will trigger seizures. Parkinson's disease is getting levodopa. You want to give them instructions, which are therapeutic. Get up slowly, take on an empty stomach, sweat and urine may become a little darker. Do not have to take routine blood work. Phenytoin and anti-seizure medication. Self-care measures we should teach the client about. When they are taking this, what is one of the things that can be altered? One of the things we want the client to do going home on this medication is to brush their teeth to reduce gingival hyperplasia. You're caring for an older adult who has Alzheimer's disease, taking a cholinesterase drug. What side effects will be concerning? Slowed heart rate and lightheadedness. You have a client taking interferon beta for multiple sclerosis. She reports she is feeling depressed and suicidal. What is the priority? Notify the provider immediately. With a patient taking dantrolene, be cautious with liver failure and cirrhosis. Tardive dyskinesia, involuntary movement of the tongue, trouble talking, trouble chewing, unusual movements. One of the adverse effects of antipsychotics for schizophrenia. Don't stop with antipsychotics. Bulk forming agents given to eliminate stool. How does it work? Using the colon to absorb the water. This is for constipation. You're taking care of a client who has a peptic ulcer. What is the best to take before or after meals? An hour before. Bronchodilators will be the most therapeutic in what situation? shallow breath sounds with wheezing in the upper lobe, for example, albuterol. What other medication do we give to people who have asthma that's not a rescue? Glucocorticoids. What advice should you give to a client to avoid complication of steroids? Rinse your mouth after inhaling the medicine. You're giving discharge instructions to a client who has asthma. They are taking theophylline. What teaching is needed before they go home? Tachycardia. You have a patient with IBD who is prescribed sulfazine. What lab value do you want to monitor? CBC. Client with chronic alcohol abuse has been admitted with cirrhosis. Reviewing lab tests, ammonia level is elevated to 218. What medication do you prepare to administer? Lactulose. A client is going on a cruise and is prescribed scopolamine patch for motion sickness. What you teach the client to recognize the necessary side effect of dry mouth. You have a patient taking cimetidine. What side effects will be important to talk to male patient? Gynecomastia. You have an adolescent client taking a leukotriene blocker. What statement requires intervention immediately? I want to die and I know how to do it. What condition would cause you to hold an order for magnesium hydroxide? Chronic renal failure, since it's metabolized in the kidneys. The client is diagnosed with IBS. They are going to sulfazine. Which intervention is appropriate when taking the medicine? Make sure the client takes 2 liters of water. Really push fluids because it can dry people up. You have a patient receiving IV promethazine for post-op nausea and vomiting. What is an important nursing action when given Phenergan? Look at the IV site for patency. You are observing a student nurse reinforcing the teaching of sulcrafate, which would require intervention by you, the nurse. Take this medicine with other stomach medicines like antacids. You have a patient taking IV metoclopramide is needed. The client asked how this medication works. You explain, it's for nausea and vomiting. It increases gastric motility and suppresses nausea centers in the brain. Peptic ulcer disease is given sulcrafate. What must the client include in giving education? Oh, I didn't get that one. Which of the symptoms might be related to anticholinergic component of the combination albuterol and ipratropium? Urinary retention. You have a client who has asthma going to use beclomethasone. What will you want to make sure you tell this patient about using this inhaler? Rinse your mouth after using it. You're educating a client regarding use of omeprazole. Will this be a statement that the patient understands how to take this medication? I should take this medication on an empty stomach before I eat. You have a patient with diastolic heart failure and has been prescribed some Lasix or furosemide. Which of the following would show that it's working? Clear lung sounds. You have a client taking bumetanide. Symptoms as a priority for this to indicate hyperkalemia. Muscle weakness and cramping. You have a client taking enalapril. Clients with heart failure taking this need to be monitored for hyperkalemia. You are preparing to give a medication and you're wondering if you should give this. Is this a red flag? Would you be concerned with giving hydralazine with a patient with a blood pressure of 168/94? The answer is no. That will give a therapeutic effect. How about furosemide with serum potassium 3.1? Yes, they are losing potassium and that is low. Prazosin with the serum sodium already at 137. Would that be concerning? No. A client having bursts of articular arrhythmias. What medication would you give to reduce this problem? You do have time to administer medication since they are stable, so do not give any chest compressions, etc. Would you want to give atropine? No. How about adenosine? No. How about verapamil? No. How about amiodarone? Yes. Metoprolol for hypertension. Which of the following would be most important to include in the plan of care? Metoprolol is a beta blocker. If heart rate is less than 60, hold the medication. A client who is taking spironolactone, why would they be taking this? For heart failure. A patient that arrives with swollen lips and tongue, the medication includes the following. Which one will the nurse ask them to discontinue? Captopril. Discharge teaching for self-care for loop or thiazide diuretic. Monitor daily weights. A patient who is going to start to take Lasix asks when it's best time to take this medication. You take it in the morning. A client is taking a calcium channel blocker. What shows that the client needs additional teaching? I will take this medicine with grapefruit juice. A client has come to the clinic seeking prescription for sildenafil. What is the priority assessment for you to ask? If they are taking nitroglycerin. If you have a client with a DVT, they are stabilized now and you are discussing taking warfarin. What shows they need additional teaching? I am going to increase the amount of dark green leafy vegetables that I eat. What is the antidote for heparin? Protamine sulfate. Hypoglycemic reactions are high risk, especially when patient is taking the following medicine. Glipizide. Client needs to increase thyroid replacement. What kind of lab would indicate the following? Elevated thyroid stimulated hormone. TSH. Which of the following signs and symptoms would indicate a need to hold a client's desmopressin? Sodium level below 128. Subcutaneous glucagon versus D50 IV. If both of these medications are standing ordered, when should glucagon be administered? In case of an emergency. In an emergency. Patient taking doxycycline. It is an alpha for BPH. Which one would be safe for client to take with this medicine? Cranberry juice. A client experiencing PMS and is asking about benefits of estrogen therapy. What comments would indicate need for further teaching? The risks for estrogen use for clots or cancer go down after use. Another true statement is people who smoke or live with smokers should not do this therapy. A client is considering a gender therapy, female going to male, wants to know the risks of taking testosterone replacement. Which of the following is not considered a risk while taking this? Loss of libido. You are caring for a female patient who takes estrogen for birth control. What should the nurse monitor for? DVTs. You are talking a little bit about naloxone. What does that reverse? It reverses opioids, the action of preventing opioid receptors through antagonist actions. Do you just give a one and done naloxone? Multiple doses is not uncommon. You can give naloxone more than just orally. Yes, you can give intranasal, IM, and IV. The agent most likely to cause serious respiration depression as a potential adverse reaction is going to be morphine. Client asks the nurse about medicines that they can be given to alleviate severe chronic pain, several months duration. The patient has been taking oxycodone. The patient no longer gets effective relief from it. What is this an example of? Tolerance. What other medications can we offer this patient beside oxycodone? Transdermal patch with fentanyl. Is fentanyl more potent than morphine? Yes, by over 100 times more potent. Can people get high from fentanyl? Yes. Is fentanyl cheap to make? Yes. Does fentanyl respond to naloxone? Yes. You have a new client with cancer reporting an 8 pain. What kind of pain management would you use to treat this bone pain? Opioid analgesics. With Tylenol or acetaminophen overdose, what is the reversal you can administer? Acetylcysteine. You have a patient on a med-surg post-surgical. What kind of NSAID can you anticipate to be administered IV? Toradol or ketorolac. Indomethacin medication is related to aspirin. You have a patient suffering from gout. What are they suffering from? Accumulation of uric acid. When you have a gout attack, would you want to add NSAID to medication of choice? Allopurinol. No, allopurinol, probenecid, and cholinesteride only. What is the advantage of a COX-2 inhibitor over an NSAID? They are less likely to irritate the gastrointercostal, so less likely to have gastric bleeds. You are teaching a patient with arthritis who takes ibuprofen for discomfort. What statement by the patient indicates a need for further teaching? I may experience tinnitus with higher doses of this medication. This is for aspirin. You are teaching a group of nursing students of why glucocorticoids are preferred over NSAIDs in treating inflammation. What statement by the student indicates a need for further teaching? Glucocorticoids do not promote gastric ulceration. This is not true. Glucocorticoids have fewer side effects than NSAIDs. This is true. Glucocorticoids help avert damage to tissue from enzymes. This is true. And glucocorticoids reduce immunocomponents of inflammation. This is true. So glucocorticoids do not promote gastric ulceration. You are caring for a client with a newborn baby. Mom's medical history includes prenatal vitamins throughout the pregnancy, 1 or 2 glasses of wine before knowing she was pregnant, occasional use of albuterol inhaler, and IV morphine for labor during delivery. What's the nurse's most appropriate action? Monitor infants' respirations and administer naloxone if needed. Pregnant mom decided to stop routine asthma medication because she does not want for the asthma attacks to harm her baby. What is true regarding asthma medication during pregnancy? Pregnant women who stop their routine asthma medication will double their chances of stillbirth. We are concerned about renal failure in an 84-year-old client who is taking several medications. In getting labs, what is going to be priority to assess? Serum creatinine. This is the best for when concerned of renal functioning. We have a client who has a visual disturbance and an elevated digoxin level. Visual disturbances can mean toxicity. It's an adverse effect. Which factor might contribute to digoxin toxicity? Failing to take digoxin when taking furosemide or other Lasix, because having low potassium affects the level. Do you have ringing in the ears with digoxin? It's all about the visuals. There's no ringing in the ears. Clients suffering from aspirin toxicity with ear ringing. Which variables contribute to this? Elevated creatinine level. Tylenol metabolized in the kidneys, Tylenol through the liver. Client is taking lithium for management for bipolar, found to have subtherapeutic serum level of a medication, so lithium is low. What variable would lead to premature clearance of this drug? Client is going to dialysis 3 times a week. An elderly client comes in taking multiple cardiac meds who has come to urgent care with an oxygen level of 88. We want to do what for this patient? Give oxygen. What behaviors would put this old man at the most risk for hypoxemia? The client takes this medication every other day instead of daily as prescribed. You're performing a pre-op drug history. You're evaluating the risk of hemorrhage. The nurse is going to ask about antiplatelet medicines as well as dietary supplements. What is one of the dietary supplements that can cause additional bleeding? Ginkgo biloba. You're obtaining a history of a client who is taking St. John's wort in addition to prescription medicines. Which effect of this dietary supplement would be most concerning to you as the nurse? It accelerates the metabolism of some drugs. You have a client being treated with vancomycin. The nurse is providing care and reviews the client blood urea nitrogen and serum creatinine levels are elevated. What will be the appropriate intervention? Call the provider. You have a client receiving cephalosporins and he has a foul-smelling stools in the past 6 hours of the shift. What is appropriate action? Call the provider and hold the medication because it's probably C. diff.